Welcome to Group 13's presentation on ovarian cancer. Through our presentation, we hope that your previous knowledge on cancer can be expanded on and that you gain knowledge on this specific type of cancer. Ovarian cancer only occurs in females. Ovaries are the primary part of the female reproductive system, and one of each can be found on either side of the uterus. Previously healthy tissue on the reproductive organ is affected by metastasizing cancer cells. This disease is chronic and non-communicable.
Hi, my name is Rachel Palijo, and I'm going to start by talking about disease causation. This is an overview of the disease causation for ovarian cancer that Allison and I will be going over in the next few slides. This is a public health tetrad where we will see the interactions between a range of factors that may lead to the discovery of disease causation for ovarian cancer. This tetrad consists of an agent, a susceptible host, an environment that brings the host and agent into the same proximity, and a vector which facilitates the transmission of agent to host. Because ovarian cancer targets the female reproductive organs, the hosts for ovarian cancer are limited to women. Their susceptibility increases when genetics are put into play. Ovarian cancer is mostly found in women above the age of 60 and rarely found in women under the age of 40. Whether or not the genetic mutations are inherited, mutations specific to the BRCA1 and 2 genes increase the risk of developing ovarian cancer. Women who have a strong family history of ovarian cancer, breast cancer, or colorectal cancer all have higher risk as well. More host opportunities stem from personal choice factors like personal hygiene, personal choices, and sexual practices. The vector for ovarian cancer can be considered as anything able to mutate DNA. Estrogen and obesity are possible vectors because they promote cancer. Estrogen is a sex hormone that is responsible for helping women mature and reproduce. It induces cell growth by binding to estrogen receptors, thus resulting to more hormones in the female body that encourage the growth of cancer cells. According to Professor Briggs, obesity is also another example of a vector because excess fat in the human body produces extra hormones, which therefore promotes cancer.
My name is Allison Idini, and I will be going over agent and environment. There are both biological and chemical factors that contribute to the agent. There is not one particular agent that can be singled out. For instance, biological gene mutations within a female's DNA are considered to be an agent. However, there are numerous mutations that can develop. Mutations to BRCA1 and BRCA2 genes are often thought of first, but there are a variety of other genes such as p53 and specific proto-oncogenes and tumor suppressor genes that also play into the agent. Proto-oncogenes and tumor suppressor genes are their own subcategories, and when an accumulation of the two types occur, the cancer is prevalent. The tumor suppressor genes do not function properly because of mutations that stop them from doing their job of limiting cellular division. Proto-oncogenes encourage proteins to amplify abnormal cellular growth. The agent can also be less biological and more chemical. Carcinogens found in a woman's environment can promote cancer growth in her ovaries. A 2008 Journal of Toxicology and Environmental Health published that talc, pesticides, and herbicides released into the environment result in a greater risk of ovarian cancer. The study noted that the evidence is still limited and further expanding. Therefore, the idea of an environmental agent being direct and conclusive is rather weak, but still important to note. This slide includes more carcinogens that pose as potential agents. The environment overlaps with the host because ovarian cancer is within the female host. The female acts as the biological environment, and her specific hormonal environment is also a factor. On a global scale, ovarian cancer has clear contrasts in frequency. The United States, Canada, Scandinavia, and the UK are the top countries to have ovarian cancer with the highest morbidity and relatively low mortality. Japan is the lowest globally for both morbidity and mortality. Public health disparities also tie in with the physical environment. African countries are seeing rising rates of ovarian cancer and related deaths due to limiting access to women's health care and screening technology.
Hi, I'm Brianne, and I'm going to be doing the pathophysiology of ovarian cancer.
To start with, the transmission of ovarian cancer is considered sporadic. It does not start any epidemics or pandemics, and it is not spread through human contact or an airborne agent. This disease is, however, endemic to females, and there is speculation that the environment can lead to a higher chance of ovarian cancer. For example, if a person is exposed to pesticides and herbicides, but there is yet to be a strong evidence of this. Next are risk factors. There are many risk factors that could increase a woman's chance of being diagnosed with ovarian cancer. For example, if a woman has a strong family history of ovarian cancer, breast cancer, or colorectal cancer. Also, if a woman has already been diagnosed with breast cancer, then she has a higher risk as well. Inherited genetic mutations such as the BRCA1 or BRCA2 gene are also other risk factors that increase risk, and smoking, radiation, having diabetes, or being obese are other risk factors. Lastly, the disease process for ovarian cancer starts like any other cancer when the normal cells become crowded out by cells with gene abnormalities. It was once believed that the ovarian cancer started in the ovaries, but more recent evidence shows that it starts in the fallopian tubes. The mutated cells will then take over, multiply, and spread to other healthy cells, creating a mass tumor of cells.
My name is Rachel Berry, and I will be discussing the disparities in public health burden that correlate with ovarian cancer. One main disparity is for women lacking access to care and treatment. Early detection is crucial for ovarian cancer, so healthcare is extremely important to receive. Low socioeconomic status and lack of private health insurance coverage heavily impacts access to care. This disparity is predominantly shown in the African American population, and many African countries are unable to provide convenient secondary prevention actions. So a woman's ovarian cancer may go undetected for years. By educating women on risk factors, symptoms, and providing appropriate care, disparities should begin to decrease. As for the public health burden, ovarian cancer is the 13th leading cause of death in the U.S., and it was estimated in 2021 that 14,000 women would die from it. Almost half of these women diagnosed with ovarian cancer live at least 5 years after diagnosis, but it does depend on the stage of cancer the woman has. As for its prevalence, ovarian cancer is representing 1.1% of all new cancer cases in the U.S. There has been a rise in ovarian cancer disability-adjusted life years, mainly affecting women aged 50 to 69. This was impacted by high fasting plasma glucose levels, BMI, and obesity. These factors allowed malignancies to grow, and to approach these burdens, the disability-adjusted life years continue to be tracked worldwide in all female age groups.
My name is Kayla Ramirez, and I'll be talking about the prevention plan for ovarian cancer. This prevention plan is geared towards young women who have not been diagnosed with ovarian cancer. Primordial prevention is especially important for this audience, as prevention works best when it is started early in life, such as with young women. This would look like promoting an active, healthy lifestyle among young women with improvements in promoting physical activity, healthy diets, and education on harm reduction for smoking. These activities target the onset of the lifestyle risks for the determinants of health with women at risk for ovarian cancer. Young women learning to understand their bodies can relate to future early screening procedures in order to promote early detection and prevention. Education on contraception and its benefits and risk factors related to ovarian cancer to those who may be at risk for ovarian cancer in the future. There are some ways in which young women can be proactive. If a woman has used birth control for 5 or more years, her risk of ovarian cancer may significantly decline. However, it is still important to note that birth control pills do not deter all types of cancer, such as breast cancer. If women have had children, their ability to breastfeed for a minimum of 12 months has been seen to reduce the appearance of ovarian cancer. Ovarian cancer may not appear in women who decide to have a tubal ligation procedure, both ovaries removed, or hysterectomy before they even see any abnormalities, cysts, or indications of ovarian cancer. Another important primary prevention strategy could be as simple as including educational pamphlets or media in primary doctor's offices, not just a gynecology office, and educating young women about ovarian cancer in schools or at their physical checkups. A lot of the times, females know the importance of breast examinations, but it is also beneficial to have programs in place that educate on the risk factors of ovarian cancer and screenings. That way, ovarian cancer does not go unnoticed, and educational efforts can reduce the unspoken stigma involved around women's health and gynecological care.